Hi, everyone. I am here with the lovely Christine Buckley from the Brain Aneurysm Foundation. Hi, Christine.
Hey, Tracy, how are you?
I'm doing well, thanks. How's it going in
Good.
Boston?
Cold, but good.
Oh my gosh, we
Happy to
keep
be
going.
chatting with you at least.
Yeah, I mean, I'm just a little further south and we're getting the same fluctuations, but at least it's sunny.
The sun I'll take. Exactly. It
Yeah.
makes a big difference.
All right. So I don't want to take up too much of your time because I know you are a very busy lady and you're probably going to be hopping on a plane soon and flying somewhere.
Friday.
Friday?
Friday, San Antonio. Yep.
Oh, San Antonio. I've never been to
Yeah, for our
Texas.
neurosurgical conference. Yeah.
Wow, that's great.
Yep.
Alright. So, can you tell me about the Brain Aneurysm Foundation and how it got started and what you guys do?
Absolutely. Be my pleasure. So the foundation now is just a little over 30 years old. And the reason it got started actually was in 1994. There was a nurse who became a patient. She had a rupture. And after her treatment and being able to go home, she reached out to her physician and nurse at the time and said, "Would you help me start a foundation?" She said, "I have, some medical background, but she said, I have absolutely no idea what to expect
Mhm.
moving on from this." Because back then, I mean, we still struggle with awareness and education, but
Right.
31 years ago, it was, very, very, very little, if anything.
Mhm.
So her nurse and doctor agreed to help her out and really didn't know what might come of this. And here we are, almost 31 years later. So I
Wow.
came on, well, I actually volunteered for the foundation
Okay.
to start. I was a volunteer for like 8 years.
Uh-huh.
And through my volunteer work, I got more and more involved and just met so many people like you impacted by this disease that are,
Mhm.
also just trying to help raise awareness and trying to help other people not go through what they went through. So what started originally as a support organization and, an education organization, which is still kind of the core of everything that we do in raising awareness. We have also now included advocacy work and we go to Capitol Hill.
Mhm.
When I came on in 2006 as the first ever employee, the first thing that I did start for the organization was a research grant funding program,
Wow.
just
You
because
started that
of
up.
all the other. Yep. Yep.
Wow.
So in 2000, I came on in 2006, and in 2007, we had our first research grant symposium. And at that time, we only awarded two grants at $10,000 each. Now we
Um,
award anywhere from like 12 to 15 grants. The minimum we give each recipient now is 25,000. So it ranges 25,000 to 50.
wow.
So we give out close to $600,000
That's
each year now,
incredible. Oh, here comes
which is
Brenda.
incredible.
All right. Let's
Oh,
see if
good.
she got it. Hey, there she
There's
is.
Brenda.
Hi, Brenda.
Out what's going on with my
Yeah, my
computer.
computer too. That's why I'm on my phone.
Yeah,
Okay.
no worries.
Oh, wow. So
Um,
Jeez.
so
so
we're
yeah,
taking
so it morphed from
we're just
education,
jumping
awareness, and
right in.
support,
Okay.
yeah, to including
Okay.
advocacy and research funding, but the heart of it is still letting people know what this disease is, and it impacts 1 in 50 people.
Yeah.
And we want the awareness and education to be the same as it is for heart attack and stroke.
Mhm.
And we're not there yet,
Right.
and I think one of the biggest struggles is, having people understand that this disease is very treatable, like you can
Mhm.
treat an aneurysm. What we don't want is if you have one to have it rupture.
Yep.
So it's all stems back to awareness and education.
Uh-huh.
And part of it is, for just your average person walking around, but also for the medical practitioners that are in an ER or a walk-in clinic,
Mhm.
or EMTs, that when someone is either saying, that worst headache of life, which should be a major trigger. But
Mhm.
again, the number of people I've met through the years that have had the more subtle symptoms of,
Yeah.
nagging headaches, maybe an earache, neck pain, and
Yeah.
just not,
Both of
they don't
us.
even know what a brain aneurysm is. So
Yeah.
they're not even thinking, oh, maybe I should get checked. So I think that's the biggest struggle. Still that knowledge gap of people
Yes.
knowing what a brain aneurysm is
Well,
and knowing if themselves or a loved one should go seek medical attention.
right. Let me ask you a question. That original nurse that was talking to the nurse then became a survivor, was that Dee Dee, your sister?
No, no, she
Oh,
was the well, no, Dee Dee was the one that helped. She was the one who started it. Dee Dee and Doctor Ogilvy
right.
were the people taking care of her.
I love Dee Dee. How's
Yeah.
she doing?
She's good. I mean, she's still all about support and support groups.
Yeah.
So her group, um, now because I mean, like so many people, she's a big, having the people together and being there with
Mhm.
them. But because of COVID, they
Um,
went to Zoom, which she definitely did not want to do.
right.
But that group now has people from all over the world on it.
Right. Once you go
So
virtual, yeah.
it's yeah, it's been, it's grown and she has a very good core group and they meet every month. So
Great.
she's happy. She loves that. That's her thing, is just to try to keep
That's her
helping
baby. Yeah.
people after they have gone through this, and the
Yep.
caregivers and people who've lost somebody.
Right. Now, another question. Well, let me give a little background. I met you
Yep.
way back
Please,
in,
my question is really kind of what brought Christine to this Brain Aneurysm Foundation. I think I'm in the middle of the sentence here.
yeah, we did talk about that a little bit, but
Okay.
she started as a volunteer way back
Okay.
in 2006, you said, Christine?
That's when I first started working here. So
Oh,
8
yeah.
years
Okay.
prior.
Right.
So yeah, a little more back up on that. I volunteered basically because my sister was one of the founders and a nurse in this space.
Okay.
And through volunteering, I just get more and more involved. And at the time, in the middle of that, I had my son, and at that time, I decided I wasn't going to go back to work full time. So I was in healthcare finance. I went to a consulting company. I was
Okay.
working 3 days a week, and so kind of volunteering 2+ a week. So
Oh,
I
wow.
just kind of got tighter and tighter into it.
Yeah.
And I was not supposed to be this person. We had kind of one of those a search out there, but there was very little money in the bank at the
Yeah.
time. So any viable candidate ended up just bowing out. And our
Yeah.
treasurer asked me if I would consider it. And that's what happened. Here
Just
I
a
am,
natural next
20
step,
years
right?
later.
Yeah.
Yep.
So
Wow.
I remember when I was living in Rochester after my rupture, and I started a support group, a local support group in Rochester, New York. And I had reached out to the BAF to give me some guidance. And at the time, in 2000, was it maybe it was 2007. So I was only 3 years post aneurysm rupture and stroke. And I met the very first survivor ever in person. We had connected online
Yep.
first. But let me back up a little bit, because in 2004, when I had mine, I remember searching and searching and searching. There was nothing. Nobody knew anything about
Yeah.
2004, about brain aneurysms then. So all I remembered was that there were famous people like Laura Branigan who had,
Yep.
yeah, not too long before me, had a rupture and died. So that's all I
Yeah.
knew. And I didn't know there was anybody locally that survived
Right.
it. So I remember
Yep.
doing all this research in all hours of the night when I got home. And just because I'm a researcher by nature, and I wanted
Yep.
to know the why and the how and what do I do next. And there was nothing really out there back then. Now we've come so far with the help of the foundation, and there are a few others out there that
Yep.
really are raising awareness about this. And I was able to talk with someone else that was at the foundation first. I can't remember her name. G, begin with the G, I think.
Ginny.
Yes,
Ginny Tachi.
Ginny, yes.
Yep.
Do you still keep in touch with her?
Yeah, Ginny's great. She funds a chair of research now.
Oh,
Ginny was my
really?
first hire. Yep.
Yes, she helped me
Ginny
so
found
much.
the office space we're in now. Yeah, she was great.
Oh, yeah.
But I still see her. Yeah, I see her
Good. Tell
usually
her
every
I said
summer.
hi. I don't think she'll remember me, but
Absolutely.
yeah,
Yeah, she
so
will.
yeah. So I set up a small group, and we didn't really connect with the hospital. So I was just setting up times in a library, in a conference room in a library, and doing the scheduling
Yep,
there. And I think we had a group of maybe 5 people on a regular basis, but it meant something because I felt like I had a
definitely.
purpose. And that was
Yep,
way back in 2007, I think. Yeah.
yeah,
And then I moved back to Rochester, and I tried to keep that going. And then, Rochester weather, and people couldn't get out. So it kind of fizzled away. And then I moved back to Long Island, where we started in 2012 with Stony Brook, which you were a great help with. Um,
yep.
so now, like you said, COVID just ruined everything.
Yeah.
It's much more difficult now to get back into the hospital because, the concerns,
Right.
about, germs and epidemic. And
Yeah.
so we don't know. Dawn and I from Stony Brook are still trying to
Yeah.
get that going again. But you and I and Dee Dee first met at Jones.
The walk.
Yep, the
Jones
Jones Beach
Beach.
Walk.
Yep.
Yeah, that's where I went, and I think
And Jake,
yeah, little Jake,
my
who's
favorite.
getting
Yep. He's a
married.
man now.
Getting
That's
married in
insane.
May. It's insane.
Wow.
Yeah, he's Mr. Army National Guard.
That's
Um,
wild.
so he's working locally, thank goodness, at MacArthur
Oh, good.
Airport, working on
Oh,
those
nice.
Black Hawk helicopters. But he's going to be a pilot, so he's got big dreams, and
Awesome.
he's going to do it. But yeah, he
He
was my
will.
biggest. He was my biggest cheerleader as a kid. I remember
Yep.
going, and he would just talk to you guys like it was just so
He did.
natural. I
Yep.
remember him
He
running
is
up
sweet.
to our local news station, News 12 was there one year, and he went right up to the woman and he goes, "You have to talk to my aunt. You have to interview her." I think the kid was like 7, 8 years old.
That's
So
so
yeah, I
funny.
was
I
on
do.
the
Yeah,
news
he was
that day.
something.
Yeah, he's an incredible kid, and now he's a grown man, but I still look at him as a kid. But anyway, that's where our connection started. And I try to do whatever I could to stay involved. And one day I'm going to get to DC with you
I
guys.
hope so.
Yeah,
I hope so. Now, because off of the DC, I mean, the runs, first of all, the runs and walks are our bread and butter. It's why
right.
we exist. It's why we're still here. Because it's just, I mean, it just brings so many people together that,
Yeah, it's a good
maybe
feeling.
they haven't met another survivor before,
Yeah,
right?
they
So
have.
it
Yeah.
just builds such community. So, I mean, the runs and walks are great wherever they are. But going to DC now, and we have a legislation called Ellie's Law that's
Yeah.
looking for 20 million additional dollars a year through the stroke subset of NIH. And that's, a struggle. We go back every year. The
Yes.
gets has to be reintroduced every 2 years, but that's a great day. It's actually a day of training before, then the day in the Hill, and we have a
Mhm.
reception after, which was great. But we had our third annual kind of national support conference this year.
Okay.
So we did it 2 years ago in Boston because we were celebrating our 30th.
Okay.
We had pretty good turnout. Then last year it was in Arizona in conjunction with our research grant symposium. But because we have such big attendance of survivors and caregivers at Advocacy Day, we decided, all right, let's do it here, because then everyone can kind of plan and either do both things or do
Mhm.
one thing. And it was a really big success. We had about 80 people that ended up
Wow.
coming and staying at the support conference. And it was kind of fun. Our second annual Run Walk in DC was that Saturday. So
Yes.
there were some people that were able to do everything, and it was just really neat. But that support conference, just so you know, it's going to stay in conjunction with Advocacy Day.
Okay.
So
And it'll
we went this year like mid-March. It'll
right.
probably be around that same general time frame
Okay.
again. So definitely keep that in mind, and we'd
I
love to
will.
have you down in DC, but
Definitely.
also be a part of the support conference. It was really great.
Absolutely. I would love to. I just needed to get more mobile because I know you guys are all
I
over the
know.
place and it's kind of exhausting
Yeah.
from what I've
Yeah.
heard the first survivors that joined
It
you.
is.
I was lucky enough to join virtually with Gina Keeley from Long Island. That one year, I think it was about five
Yeah, we
years
did, I
ago.
think in 21 maybe.
Yeah, I
I
think it
think it
was like
one
5 years ago. Yeah, and
that
that
we had
was
to do it virtually, yeah.
yeah, that was great. I was happy to join then, but I would like to be in person because it's just phenomenal what everybody
Yeah.
does.
Well,
And
you meet people from all over. I mean, we had people from like 23 different states, so
wow.
you just meet so many different people.
Yeah.
Yeah, it is. It's really great.
And who else comes to DC other than survivors? Are there like donators that go or
Yeah, everybody. There's some people from some of the device companies. There's, deaf people who are, I mean, our donors are basically someone impacted, whether they lost somebody or
yes.
they are a survivor or caregiver. So, and then some medical people come and some of our researchers come. And
Okay.
those are like, it's really great when you have someone either medical or research
Yeah,
in the
that's huge.
meetings to kind of hone in on what exactly it is or what research is ongoing and what needs to happen and things like
Mhm.
that. But it's a good mix of people. And some of the groups have like a leader from the law firm that help set up all the meetings and things like that,
Oh, okay.
which is
Great.
super helpful.
Yeah. Now,
So
let me
I
oh, go ahead,
I
Brenda. Go ahead.
have a question because I came in the middle, and I know that Christina, I heard you talking about the fact that a big goal is education, obviously, so people can know what they're experiencing. And I'm curious because I did not have a ruptured aneurysm, but I had a hemorrhagic stroke. We don't need to get into the details, but I'm curious how much crossover there is with you and other organizations because education is education. We all need to know when there's something going on,
Right.
regardless of thing. So I'm curious about
Mm.
that.
Yeah, I mean, we're coming up on Stroke Month, as you probably know. May
Mm-hmm.
is Stroke Month. Aneurysm Month is September, and that is something we did last year. We did a little work with the American Heart, American Stroke Association. We did
Right.
a podcast with them, and then we developed a fact sheet that has information on both hemorrhagic and ischemic stroke. So
Right.
to your point, like if they're somewhere in that, it will cover both forms of stroke. And that's been a struggle, honestly, because stroke is so well known.
Yep.
And I think because there's so much money in the space with pharma and there's just a lot
Mm-hmm.
more there to bring attention to it, that I feel now the medical community, and you probably missed earlier, I'm going to a neurosurgical conference this weekend in San Antonio. And,
Wow.
part of what we do there is talk about, bolstering the education and awareness, but partnering with an organization like American Heart and Stroke is huge because they are like a gazillion times bigger than we are, have
Yep.
a multitude of resources. But we're just trying to tell, when we spoke with them and we speak to practitioners, like if you are talking about stroke, the hemorrhagic stroke, you should always have some kind of snippet or
Some
something to say
subset.
about
Yeah.
ischemic, you
Now,
know,
in
if,
your
or
research and
ischemic,
all,
I should say,
yeah.
is covered, but it's the hemorrhagic we want
Right.
people to focus on. So if you're talking about the clots, the ischemic stroke, talk about the bleeds and the
Yes.
hemorrhagic stroke.
Thank you. Thank you.
Yeah.
Yeah.
So I feel that is getting better. And another thing on education is we started to work with some different groups of medical students, and they actually presented at the support conference, these medical students from Kansas, and they are shocked themselves to learn that in their curriculum there's very little said. It's about ischemic
Ew.
stroke. And on the national boards that they take, they showed, and some physicians in there were horrified. It's like 0.00008% of the questions on their national board exams touch upon aneurysm or hemorrhagic stroke. So they are now working with
Crazy.
their mentors in their school to, what is the process to try to change that. So I do feel good about these young folks in medical school now that are kind of working with us to find ways to have there be more education.
Right. Now,
That's great.
yeah, because any aneurysm rupture, or like in Brenda's case, a cavernous malformation rupture, which I never heard of,
Hmm.
which is along the
Yep.
lines of like an AVM, but it's a little different.
Right. Yep.
Anything that ruptures like that is essentially a hemorrhagic stroke, correct?
Right.
Right. Once
Yes.
there's bleeding, active bleeding in the brain, it's considered a hemorrhagic stroke. Now,
Correct.
Brenda brought it to my attention how much more, not rare, but how less common it is than an ischemic stroke, a hemorrhagic stroke, which I
They
didn't
are
know.
less, but like 5% of all new strokes are caused by a hemorrhagic stroke. So I don't know, when you had your rupture, I mean, when someone ruptures, they're being watched for 2 weeks because of the vasospasms that can then
Yes,
cause an ischemic stroke. So there is a very tight connection.
I see. Okay, so that's the worry with the vasospasm, that then a clot will get thrown and then,
Yes. Yep.
oh, I didn't know that. See, I'm still learning
Yep.
after 22 years.
Yeah, it's that 14-day period, and yeah,
Yeah,
it's
I
and
remember
it's
them.
super scary when someone's ruptured and then the family's like, well, they could have a stroke now too,
Right.
a
Yeah,
clot, you know?
I
Right.
didn't know that when I was in the hospital, and it was interesting because I remember when I first came to after they stopped the bleed and I was in ICU, And they had warned my family, like, "We don't know if she's gonna survive, yada, yada, yada," through the surgery, and I was fine. I was talking, the headache was gone. I was like, "Okay, I can go home," and they're like, "No,
Right.
you're not gonna go
No.
home just yet."
Yeah.
So I didn't understand
Yeah.
anything about it in 2004.
Yeah, that's why they
Yeah,
can't
the
just
and I heard that term come up. I'm like, "What the heck is that?" But before then, they had said to my sister, um, "We have to make sure it might be an AVM that ruptured." This is before they learned it. They were 3 aneurysms. So
right,
I'm like, "An AVM?" Now this is again 2004. No one knew anything about it. It was just a bad headache, right?
right.
So they ruled out an AVM, and now I know much more about it because, those 2 are deadly, and I do know
Yeah.
Gina Keeley, who you met, who started the Paige Keeley Foundation, because
Yep.
her daughter passed away in school at 6 years old,
Mhm.
which is horrific, and that was
Awful.
locally,
Yep.
and she's doing amazing things with her foundation, to get people scanned to prevent the rupture. And
Right.
I know everyone's working so hard to make, especially for siblings of someone who had a rupture, because there is that genetic connection. Um,
Right.
in my case, there isn't. I just am a freak of nature medically. So my brother and sister don't have to worry about it. They were told, but a lot of people have no signs or symptoms, like we know. But
Right.
there's someone like, I wonder if my grandfather, who died of a brain bleed in the 80s, was that.
Probably.
Yeah, exactly. He's my
Probably that other
grandfather,
person, yeah.
and as of now.
Highly likely.
Yeah, exactly. They didn't know anything in the 80s.
Yeah.
So I'm hoping that more people are aware and they start putting that in physical, like, annual type of screenings. Because I know,
Right.
is that something you're part
Well,
of
it
as
is
well?
hard. It is something that we're working on, and that's sort of like another advocacy initiative because right now the rule of thumb you have to have 2 or more people in your family for a doctor to readily order a scan and for an insurance company to pay
Right.
for it. And that's something when we've been on the Hill over the years, people don't understand. Like, why would you wait for this to happen to somebody
Yeah.
else, right? Where half the people who rupture die, 2/3 have life-altering disabilities. Like,
Mhm.
what are we waiting for? Like, pay the money up front for a scan.
It's all
So,
money.
A, to save a life or to not have someone be in disability forever.
Yeah.
So, it's a nut we're trying to crack, and I think you probably know, again, the data, hard data and good numbers on this disease are just they're old. The references are
Yeah.
from studies in 94, 2000.
Yes.
So, we are trying to what's happening now, there is someone capturing like cost savings data that if you scan a woman who's a smoker in that age 35 to 60 age bracket, it is a cost savings to society because
Yeah.
the smoking just elevates it off the chart.
Mhm.
The chance that someone who has some risk factors would rupture. So it's a starting point to start using that. I mean, I think it should roll it out to men equally at the same
Yes.
point in time, but you need someone to get the data somehow through some study. So I think it was the easy target first to focus on the smoking in the women
Yeah.
because they're at
We're more
greater risk as
common.
well. So hopefully, that's going to help move the needle to try to have if somebody and it is strange sometimes you meet someone in a family that already knows there's been a couple people that some people
Mhm.
don't want to be scanned, which I find hard to understand because the treatments are so good nowadays.
Right.
But I certainly think most people do want that opportunity, and I think they should be able to have it.
Yeah. Now, we talked with Paul Nash, who lives in Canada, and his friend. They both had a brain aneurysm rupture, and right, Brenda? They both had a brain aneurysm rupture and a hemorrhagic stroke, and it was shocking, and it was shocking when I went to the hospital. I was so young, like, everyone told me that.
Yeah.
I was 32,
Yep.
and Paul was young, and his friend was also young. So they started a movement to make people understand that this can happen to anyone at any age. And
Yep.
the medical world, they only really focus on people 65 and over. So
Yeah. That's bad.
so there's not even a lot of education around young survivors. And now 32,
Oh,
that
there's so
this
many
is.
young people
Yes.
impacted. I mean,
So they
the
started.
Ellie's Law in Capitol Hill. Ellie was only 14 years old and died her
Right,
second day of high school.
right. So, like Paul and his friend, Erica, that's her name. They started a page on Facebook and TikTok and all that called Brainstorm. And I don't know if you've seen it at
Okay.
all, but yeah, they're
I have not.
okay.
I have
I
to
can,
look it up.
yeah, Brainstorm. Is
I
that
write
the
it
whole
down.
name, Brenda? I think. Yeah.
Yeah, if so, yes.
Okay.
Okay.
So, and if you go back to our podcast episode, I think it was like 4 or 5 previous episodes, we talked with Paul.
Okay.
It's the one with Paul Nash. And he's really concerned that all of the studies and everyone in the medical field, when it comes time for statistics and when it comes time for discharge plans, they're focusing on the elderly because in their
Yeah.
minds, it only happens to people 65, 70 and older.
Right.
So,
Right.
there are different, what his point was there are different plans and goals when you are 30 something years old or 40 something years old and this happened to you when you're going home. Now, your
Right.
plan in the
Right.
future, you can still rehabilitate possibly, and you can still, with treatment and care, go back to work. And that's everyone's
Right.
goal, really, when they're that young.
Absolutely.
So if someone in their 70s has a rupture or stroke, hemorrhagic or ischemic even, um, their goals are much different. They'll most
Right.
likely retired already or close to it,
Yeah.
or their goal, their plan is to move in with family or go into a nursing home, much sooner than someone in their 30s and 40s. So it really opened my eyes to how much it has changed from even 20 years ago, 22 in my case, when no one heard of it.
Right.
And even when I went to St. Charles Hospital, Long Island, for rehab, everyone in that hospital was, "You're too young for this to happen to you. You're too young.
Yeah.
You're a baby. You're a baby." I'm like, I'm 30,
Yeah.
I'm 32. Like, I didn't feel like a baby, but in their eyes,
Yeah. You were.
so all of that needs to be updated. And,
Mm-hmm.
it's just incredible to me that with all these advancements, now I understand that now people survive, a lot more people survive because of what you do and with the education and awareness. Now, doctors know now to look for that when they present in the ER. Like when
Right.
I first went to
Right.
the ER, my brother saw me have a seizure and go unconscious. So
Yeah.
they were searching for an epilepsy seizure disease. So it took them
Yeah.
6 hours to realize I was bleeding in the brain.
I know. It's awful.
Yeah. So now at least there's protocol that this could possibly be an aneurysm, AVM, cavernous malformation. So at least that's there. But I think, like you said, it's with the younger medical students
But
because,
it's also not everywhere.
yeah,
There still is not a standard of care across the board. A lot does depend on where you live and if there are more major centers where, like,
hmm
say, those EMTs have better training than in a more rural community.
oh,
So that
absolutely.
is still like a point of contention. But to your point, there has been improvement, and that's sort of what we always want when somebody, that first responder, is to bring a brain aneurysm into the differential diagnosis and consider there's a brain bleed and not just say,
hmm
is this person on drugs?
Right,
Or it's
right.
that's come up sometimes
That
and people have
but
been
they
left. And
Yeah.
have right, Christy? Yeah.
What
yeah,
was that?
so
When Lisa had her accident, they
Yeah.
thought she was drugs, yeah.
Yeah. They thought
yeah,
she was a
and I've
drug
heard that
addict.
a couple times.
Yeah.
Yeah.
Yeah, or, and just not really even considering that possibility. So we just want it to be considered,
Yeah.
to have these medical professionals think about it.
Right.
And we
So,
also do something with
but
some of our doctors on our board that speak to primary care doctors, MPs, and PAs where they go for their CME accreditation. This organization called Primed, and so the people who are professionals in the neurospace talk about detection and management of brain aneurysms, and it's
Good.
amazing the response that has come from these sessions. Because you also have to remember someone that is primary care and just seeing people all the
hmm
time and
Yeah.
crunching them through, they become heightened to think, wow, I really need to pay more attention. So we get always these feedback forms. And it's amazing the doctors after these sessions, just like 800 to 1,000 people in a
Wow.
room, will line up to ask, a treating surgeon, like, more questions, and
Mhm.
the thank you notes that they have received because of listening to this lecture, and someone came to me and they took a little more time and sent them for a scan and found out they had an aneurysm, got treated, so
Yes, and
there is
that's
value
yeah,
at all levels to consistently educate.
right.
So, Christine, my follow-up question to your education piece that you're talking about, because clearly there needs to be education to more accurately identify and treat and hopefully avoid the rupture. But do you also have a piece of education after someone has had an event? Because
Yes. Yeah,
as
we do. We have some recovery materials, but then that's also why we have the support groups. And we're actually currently working on a whole new kind of take home folder for
Mhm.
people to have. So we're just in the midst that will probably be ready to roll within a month.
Great.
So we're going to certainly reach out to everyone on our medical board and any major treating center to have those available for them. But then, are they going to give them out is the other
Yeah,
piece,
that's the thing. You
Some
need
people
some kind of
some
personal
people will
connection.
some people will be great about it and others maybe not, but you have to start, right? And give
Yeah,
them an
at the start.
opportunity.
That's like with my business that I'm starting, I'm making those connections now. I think I told you about that, right?
Yes,
What
yeah,
I'm
tell me
trying to
more though.
do. Yeah, it's basically for those who have gone through a traumatic, a stroke, brain aneurysm rupture, any kind of stroke, ABI, TBI. When you're first discharged from the hospital, there's no real guidance. Like we joke
Mhm.
that the surgeons are amazing, then they changed their
there's
life.
your
They
life,
saved it. They saved their life. And then they're like, "All right, we did our job. Good luck.
Yeah, bye-bye.
Vaya con
Yeah.
Dios," you know? I
Yeah.
mean,
Yep, it's true. It's
it is
still
so
true.
true,
Yeah,
and you have to be and thank God I had my sister as my advocate because she is
right. You definitely
relentless.
need one.
Right. Now, I try to do that for others now that I'm 22 years out. I have
Good.
recovered probably as much as I'm going to recover, and I have more energy and I have more clear thinking. So I'm starting this business, and sadly, I can't just provide it as, a nonprofit because I need to create income for myself because I've been with very little
Right.
income for 22 years. I was a teacher
Right.
and worked in social work in my previous life. So, that was
Yep.
all gone. And Brenda, too. I mean, we met in college. That's how Brenda and I
Oh, funny.
connected.
No way. Oh,
Yeah,
that's
we
wild.
met back in SUNY Geneseo back in about 1991 or 92
Wow.
through a mutual friend of ours. And we lost touch after graduating. She graduated a year after me. She's a little younger than me. And we lost touch. And then I happened to see her tagged, or I happened to see a post with her because she's not a big social media gal. But
Yep.
I saw a post she was tagged in that, she was doing the walk for the Terry Fox Foundation in Canada. And I'm like, oh my gosh, it's Brenda. So I reached out to her, and that's how we reconnected probably
Oh, that's
about
great.
3 years ago. So, I have to give kudos to social media because it does bring people back together.
It does.
And it
Yeah,
is,
no, that is true.
yeah, it is great for sharing information and keeping up with people.
Absolutely.
So, with my business, I'm trying now. I'm starting with Stony Brook because I have that friendship and connection with them and with Dawn
Yep.
Madigan. And I too am first trying to build a network of referral bases.
Yep.
So I'm reaching out to hospitals and I'm hoping to do like not orientations, but presentations to their staff, the neurosurgical staff and the social workers to be part
That's
of
great.
the discharge plan and have a flyer, a one-page thing that when they come into the
Yep.
clinics for their follow-up, that I can, they can consider me because mine is like 4 people that are lost when they go home and the chaos hits of
Yep.
all the follow-up appointments, all the medications,
Yep.
all the life-changing feelings that come with it
Yeah,
for
it's
the
awful.
survivor. You feel so lonely and you just don't understand why and what happened. And also for the
right?
caregivers, because I really think the
Absolutely,
Right.
caregivers
absolutely.
so that's a big
Oh,
piece.
100. Yeah,
Yeah,
that's a big, big
that's a
piece.
big
That's a
piece.
really tough role.
Yep. I mean, look at my sister, real estate agent, 2 teenagers at the time, and pregnant with Jake when this happened to me.
Right.
And, Jake was my angel, of course, because he was born 7 months after the aneurysm rupture, so I had
Right.
that to get up to every morning, like, I helped take
I
care
know,
of
which
him.
is a blessing. It's
Yeah, I mean,
crazy.
you need a purpose. Everybody,
Yep.
especially
Yep.
an active worker somewhere in the community, you want a purpose. You want a reason
Right.
that you're getting up in the morning and you have something to do. and the only thing I had to do at that time was to help take care of Jake. So that was
Right.
my,
Yeah.
that was my way of getting up and about.
I didn't want
Yeah,
Yeah, not everybody has that either.
right.
And some people don't have an advocate like you did with
Yes.
your sister,
Yeah.
so it is really hard. So it's good you're gonna be a resource to try and help people.
Yeah, and mine's all virtual, and
I was just gonna ask you if it's all
yes,
virtual.
it's
That's
all
great.
virtual, because I'm trying to keep overhead low, so I won't need an office space. I won't need any of that. I just need my subscriptions to Zoom because that's where I'll be doing I'm really like a
Yep.
coach, and I make sure that
Yep.
it's very clear on my website that I do not provide medical advice. I do not
Right.
provide
That's the
mental
key.
health.
Yeah.
Yeah, like I am not
Yeah.
any of that. And that's
Yeah.
everywhere on everything I'm handing out or everything on my
You're
website.
right. That has to be. But I mean, you're experienced. You have
Yeah.
lived experience,
Yeah.
right?
22
I
years
mean,
of lived
that's the key.
experience. Yes. So
Um,
the support groups too, I'm providing a link to Zoom and I'm going to set up small groups for survivors and a separate one for caregivers. And
oh, nice.
a lot of my program has offerings that are for the caregiver alone because they have their own issues that they're dealing with, and pieces and worksheets and toolkits and guidance, one-on-one and group, small group, to the survivors and the caregivers. So
Great.
I'm hoping that no one has to go through what I went through 22 years ago.
So what's the name of it?
It's called Clear Path Recovery Solutions,
Okay.
and I am registered in New York. So it's a legit business and I have an
Yeah.
EIN and it's just me
Okay, good.
solo right now. Um
Yep. Great.
yeah, so I'm developing everything now. I don't have any clients and I laugh about that, but hopefully soon. I did get a call,
Yep.
however, the other
yeah.
day, my first business call from a man in Texas who somehow saw one of my TikToks or one of my social
Yeah.
media posts.
You never know how it's gonna
Yeah.
start.
And
That happens.
he's
Yeah.
a survivor of 33 years. So
Yeah.
he's going through everything and he's very determined. And he wanted to pick my brain about what I thought about neuroplasticity. And
Oh, okay.
he feels that, he was, I think, in high school when it happened to him. And they told him, if you don't get to these goals by the first year, that's probably it. I was told that.
Yeah, I
Right.
know, which is horrible
It's
because that's so
horrible.
Right.
Now they
untrue. As you
know.
know, your brain recovers, and it takes
Right.
Yes.
time and years. You're not who you were 20 years ago,
No.
10 years ago, or probably even 5, right?
Right.
Right.
So we talk about that all the time, that there's always a chance of regaining some skills or things
Mhm.
through neuroplasticity and just making those synapses connect around the area that was, deadened from the stroke, from the bleed, and things like that. So, yeah, I was really excited. Now he's not going
Yep.
probably to be a client only because, I'm starting locally. I'm starting because I
Right.
know this community. I know Long Island,
Right.
and I want to
Right,
know
and
what I'm
knowing the
working with.
resources, that's what's hard, right? Because 'Cause
Hmm.
they're different per community.
Right. There
I
was
mean,
nothing.
basically, you could still have to tell people what to look for, but
Right.
you will definitely be expert where you are, but people still need to know, like, even
Yes.
where to begin, what sort
Right.
of rehab or what
Even
kind of
what
agency, and
questions to
people
ask even,
nothing.
What was that,
right?
Brenda?
Like, even what questions to ask,
Yeah.
because
Right,
who
I have a
knows what
absolutely.
Yeah, I have a doctor, Dr. Rye, where I get my neurotoxin injections because do you remember my left hand was in a very tight fist and now he's loosened
Yep.
it up with I don't
Wow,
use
that's amazing.
I can't use the fingers, but at least lessen that grip. Now
Less
we
right.
kind of went a little overboard because I'm kind of too relaxed on that. But we're working, it's all about getting the right dose into the right
Right,
muscle.
I can imagine.
Yeah, so he's Dr. Paulinder Rai, Rai, and he's incredible. We did an
Wow.
episode together, and I wanted him as a guest, and he's just so busy with his clinic, um,
Right.
that I said, you know what, I'm coming in for an injection, and this was after my total knee replacement surgery. So he didn't work on my
Yeah.
ankle, and because I have a lot of tightness in that area too, in my calf.
Okay.
So I said, "Can I record my injection session with you?" And he's like, "Yeah." He goes, "As long as you don't care about putting your information out there." I said,
Yeah.
"No, that's what this is all
Nope.
about. Like, I'm not
that's right.
Right.
gatekeeping or hiding anything that I'm going through. I mean,
Yeah.
this is reality for me. I have nothing to really hide." Um,
Right.
So I recorded, and that was probably 3 episodes ago that you'll see,
Wow.
Dr. Rye. Now we've built a connection, and he was so, impressed with how I edited, because I do the editing and do the posting social
Oh,
media,
awesome.
and then Brenda joins in with her posts for Instagram and stuff.
Nice.
Yeah, so he
I'm not. You're the technology side of things.
Yeah,
So
no,
I'm
I'm
just.
not very good at it. I use a lot of AI and a lot of apps, so yeah,
Yeah,
just
that's
to save
okay.
some time,
That
right?
works.
So he now wants me he's putting our podcast link on his website for the Right
Oh,
Clinic,
nice.
and his
That's
clinic,
great.
yeah, his whole business, his siblings, his wife, his parents, they're all doctors. It's
Yep,
amazing. So
that's amazing.
I got a phone call from, his sister, Rosa, but I didn't know it was his sister at the time, so she called to confirm one of my physical therapy appointments, because they provide physical therapy right there in the doctor's, building. So she goes, "Oh, Tracy, you're coming in tomorrow for physical therapy, right?" I said, "Yeah, definitely." And she said, "You're a movie star around here." I'm like, "What? What are you talking about?" And she goes, "Oh my
I love
gosh."
it.
She said, Paul shared in our family chat the video he did with you, and it's amazing. We were so excited. It's so good.
Oh, that's
So,
great.
yeah. So now, with him putting our podcast on his website, we're hoping to get further reach. But he
Good.
also wants to do more recordings, because he laughed. He goes,
That's
he
funny.
said, "I have to pick your brain." He said, "We try to do a podcast because I love connecting with people to get
Yep,
information out there." And he goes, "But we didn't know what we were doing, and it didn't last long." He goes, "So, he goes, I wanna pick your brain about getting our podcast stuff." I said, "Absolutely," so now he's asked me
oh, that's so
questions.
great.
Yeah, so it's really nice, and, just the fact that I can now email him and say, "Hey, I put a bunch of clips up on Instagram and TikTok and stuff," and he's like, "Really? Let me go check." So it's nice, because
Yeah.
he's happy to do it, and I'm going to be recording. My next visit with him is May 13th, I think, so
Okay. Oh, that's awesome.
yeah,
I
we're
love
gonna
that.
record. I'll do better at the camera work, because when you're getting 8 shots, big needles in your arm, and I'm
Oh.
trying to hold the camera just right so they can see. But so I'll do better. I'll be more prepared for
Oh,
my
that's so
recording.
funny. I love that.
Yeah,
But
so
Well, me.
that just speaks to the whole idea of education and sometimes also just connection for people to
yeah,
feel like I'm not the only
Oh,
one going through
100%.
that.
yeah.
Right. I agree with you, Brenda.
I mean, how much of getting anywhere in life is what you know and what you've learned and who you know, you know?
Oh, it's the who.
Yeah,
We
it's
all need the
always
who.
the who, and that's
The who pushes its things to the
Yeah,
next level for sure.
especially if you're likable. I mean, if you're a
Yep.
negative Nancy, you're not gonna get very
It's not
far.
going to work out well. Yeah. Well, like I said, I'll have to get you on our podcast next
Yes.
too. I'll
Yeah,
reach out to schedule for that. I think that will
definitely.
be good. And you can talk all about this and what you're doing, and people can hear about it and then know how to
That's
find you,
great.
right?
That's wonderful.
And
So
and
yeah.
Christine, do you mind talking a little bit about, because you mentioned the run walk that you do? Because as Tracy said, that's how she and I connected, because she saw, and for me, I just started to do this. It was I had my stroke in January of 2020. So in that following September, my husband thought, "Oh, that's a good idea. Let's just do this 10K."
10K a year after.
Yeah.
I can't even imagine.
So,
And I don't wasn't doing it to fundraise. It was more like a personal goal for myself. And I kind of loved that it was about the Cancer Society. It wasn't had anything to do with me, because I was really trying to create some distance. However, it was just not long ago that my husband said, maybe we should actually pivot our focus a little bit. So I'm curious if you could talk about this run walk that you do.
well, we do them all over the place. So the one that's coming up back in Jones Beach, that
Yay.
was a good
But
connection.
you don't do one in Canada, I'm assuming.
Yeah, do you do any
No,
in
we
Canada?
have a couple actually. We do have a couple in London, Ontario, I want to believe.
Okay.
I can't think of when it is. I'll have to go back and look. We want more though.
Oh,
She's in
But the one
Montreal.
in
Yeah.
yeah, all right, we can talk about that for
yeah.
sure. Um, September 19th is the one on Long Island, just so
Okay.
people know.
Yes.
And for the first time this year, it's going to be a run and a walk, a
Oh,
timed
really?
run. So hopefully to get some more people involved. Because yeah, people just like to people like to run a 5K apparently,
Yeah,
you
and
know,
we're
and
right on the
get their best
water, on the
time or beat
boardwalk,
somebody.
yeah,
Yeah, so we're looking forward to that. It
yeah,
was a big event some years ago. It was a Dr. Chalif, I mean, who spearheaded that with us.
yeah.
He brought that event to Long Island, and he's no longer there. So, I mean, again, share it with Stony Brook, Tracy. It's
Okay, were you still
anybody.
looking?
It's a 2026 annual Long Island Run Walk. So it's
Okay,
generically named. Like that's it. We just want people to come
just
and
Long Island,
be a part
Jones
of the
Beach,
community that
yeah.
day.
Everybody
Yeah.
knows Jones Beach, so I was curious about that
And
'cause
you should come and you should have a table there with
yes,
information
yes,
on your
I
company.
will. I'm going to. I couldn't do it last year because I was in so much pain with my knee. I was having a
Oh, yeah.
real bad. So
Yeah.
now I had my surgery. I'm on. I had it 2.5 months ago, so I can actually walk without pain. I have a little bit,
Right.
but I can use the
Yep.
cane, and I also have an e-trike, a three-wheeler e-bike that I
Oh, you do? I
love.
love that.
I mean, I've seen people ride their bikes, bring their dogs.
Yeah.
So
Oh, yeah.
yeah,
So it'll be great. I mean, it's come back up. It's not quite where it was. I
right.
mean, there was X hundreds of people there last year. There was a good crowd. There were people that had always been there, and there's new people,
Yeah.
so it's nice. So,
Yeah,
um,
definitely, I'll be
but
more
yeah,
involved.
happy to talk to Brenda. Get one in Montreal. We can make it happen.
Yeah.
We are
Well,
also a
well,
registered charity in Canada, so
I was
we're
even
set to do anything.
I do my regular 10K, but raise funds for your foundation, which would be great. I could do that.
Oh
Yeah.
yeah, absolutely. That totally works too.
Okay,
Yeah.
so we'll connect about that.
Yeah,
Yeah.
And,
awesome.
and
Great.
Tracy, maybe you'll come do 10K with me here.
Yes, I have not been to Montreal yet. We've had podcasts with her family, her husband, and then all three of her
Oh,
kids.
great.
But I
Oh,
haven't
that's
met them in
nice.
person yet, so I do want to make it now that I'm feeling better and I can walk a
Yep.
distance.
I
I'm gonna
know. I
get
can't
up.
believe old college buddies. I love that.
Yeah, it's great that we reconnected. So I know you're a very busy lady. So I don't want to go too long with this because you probably have
Yeah.
umpteen million things going on. But thank you so much for being on with us.
Thank you.
No, I appreciate it. I appreciate the opportunity because it's any avenue to get the word out,
Yes.
right?
Yeah.
And people come to the website, bafound.org. There is a ton of information
Yes.
for patients, family, newly diagnosed. We have webinar recordings, our
Mm-hmm.
podcast recordings, and we, like you, you're trying to
Get the word
reach
out.
people in different ways, right?
Right.
So I think
Okay.
doing this and getting you to do a podcast as well will be great, and just keep raising
Great.
the awareness, spreading the word on, a disease that is very treatable, but you need to know that you have it, right? And
Yeah.
we want a world
That's the
without
big
ruptures.
key. Right.
Yeah,
How
we're
often
not
do
able to.
you go ahead, I'm sorry.
Go ahead. No, I
Um,
said we're not able to stop an aneurysm from forming yet, no, because
right.
they don't know enough about how, why, and when. But we can stop the ruptures, and I think that's the most important thing for people to know.
Yeah, the screening there is huge. What was I just gonna say? How often do you record for your podcast, and often do you broadcast an episode?
We do we put them out monthly,
Okay.
so we record it whenever.
Okay. Right.
Because everyone's schedules are so different. So
Yes.
we just set up times to record. And
Then you have
so Grace puts them out once a month.
okay.
So we have another one already that will be going out in May.
Great.
But we
Yeah.
can record anytime and then
Right.
put it in the lineup.
Yeah, we're crazy. We try to do once a week, and
Yeah,
and I don't know
We're crazy.
why.
Yeah, I did do once
that's
a week.
okay.
Well, there's
It's not a bad thing.
Yeah, our newest one I put up yesterday is on YouTube. So our whole episodes are on YouTube. And then
Okay, good.
I cut them into clips to put on the other avenues, those TikTok,
Yep.
Instagram,
Oh,
Facebook.
awesome.
Yeah, and
Yep.
that's
Yeah.
another app I use. Um,
Oh, do you good?
yeah, because it's time consuming. I mean, editing,
Right.
even with all these tools and
I don't
AIs.
do that. We have Grace who does
Yeah,
that,
Grace is
does the
amazing.
posting and all that.
Yeah, it's a lot of work, but I enjoy it. I'm a geek like
Yeah,
that.
no, I can
Yeah,
tell, which is great. And I'm
yeah,
glad you're doing it. It'd be a
yeah.
great resource for people.
So,
Brenda, nice meeting you too.
yes,
so nice to meet you,
Thanks for
Christine.
joining.
yeah, we'll
Thank
be
you.
in touch. Yeah, she'll be in
Awesome, for
touch about
sure.
setting up Montreal, and I'll be in touch about being on the podcast. And if it
Yep,
works out and Brenda can join, maybe the both of us can be on.
100%. You're
Okay.
more than welcome. I'd love to have you both.
All right.
Okay, thank
Great.
you so much.
Thanks,
You have a great
everyone. Thank you so
Okay.
much
Thank
for
you.
being on. Thanks, everyone. Take care
No, my
now.
pleasure. Thank you.
Okay.
Bye bye.
Bye-bye.
Bye.